Welcome to this video tutorial on diabetes complication. Diabetes is a group of metabolic diseases characterized by hyperglycemia, caused by defects in insulin secretion, insulin action, or both, and it affects both adults and children. Uncontrolled diabetes can result in metabolic imbalance, which can lead to acute complications. Chronic complication will result from ongoing hyperglycemia. Let us begin with acute complications that necessitate immediate medical attention. Hypoglycemia, or blood glucose level less than 3.9 millimoles per litre, is a possible side effect of insulin therapy or oral hypoglycemic agents. It can also be caused by skipping a meal, eating infrequently, over-exercising, or drinking alcohol. The most common signs and symptoms of hypoglycemia are adrenergic or neuroglycopenic. Adrenergic symptoms, which include being pale, sweaty, having tachycardia, palpitations, nervousness, irritability, feeling cold, weak, trembling, hungry, usually occur first as a result of a rapid drop in glucose. The specific signs and symptoms vary depending on the blood glucose levels. Looking for a mnemonic to help you remember the signs and symptoms of hypoglycemia, then please look in the link below and you can watch that video also. Diabetic ketoacidosis is another serious acute complication that occurs when excess blood acids, known as ketones, accumulate in the body. Ketones are produced when the body uses fat for fuel rather than glucose. This can happen when the body does not have enough insulin to process sugars. DKA, diabetic ketoacidosis, is also caused by illness or lack of insulin. The progressive hyperglycemia causes glucose to leak into the urine, causing water and electrolyte loss, dehydration, and increased thirst, and must be cleared from the circulation. DKA can occur in patients with type 1 or type 2 diabetes, but is more common in type 2 diabetics. Let's look at some of the chronic complications of diabetes that can occur as a result of persistent hyperglycemia. They can be divided into microvascular or macrovascular. These complications are caused by the duration and severity of hyperglycemia. Microvascular complications affect smaller blood vessels in the body, such as the eyes, leading to diabetic retinopathy, kidneys, diabetic nephropathy, and nerves, diabetic neuropathy. Microvascular disease may also impair skin healing, causing minor skin breaks to turn into major infections and deep ulcers, particularly in the lower extremities. Blood glucose control can prevent or delay many of these complications, but it may not be possible to reverse them once they have occurred. Atherosclerosis of large blood vessels, such as those supplying the heart, brain, and extremities, is a cause of macrovascular complications. Angina, myocardial infarctions, transient ischemic attacks, strokes, and peripheral arterial disease can all result from macrovascular disease. So the mnemonic that we're going to be looking at is diabetic. And this mnemonic will basically give us an outline of what the possible complication that can occur as a result of diabetes. So D is equal to dental disease. I is equal to infections such as oral candidiasis and periodontal abscesses and skin abscesses. A is equal to abnormal sensation, which can occur as a result of peripheral neuropathy. B is equal to blood sugar. Low blood sugar can lead to coma. E, erectile dysfunction. I's, retinopathy. T, traumatic ulcers, diabetic foot disease due to neuropathy and peripheral vascular disease. I equal increased chance of renal complications, nephropathy. C equals cardiac complications, ischemic heart disease. CVA, cerebrovascular accidents. Well, thank you very much for listening. If you've enjoyed the mnemonic and you found this useful, then please kindly like and subscribe to our channel. It will really tremendously benefit us. And if you've got any mnemonics or subjects that you want us to create, then please kindly comment below and we will specially make. Thank you very much for listening. Bye bye.